Hey guys, welcome back to my channel. My name is Lokesh Raut. I'm a final year medical student at Orenburg State Medical City और मेरे साथ मेरी senior है Dr. Srivathy Narayan. So proper from Chennai, Tamil Nadu, exactly, or some other city, or exactly Chennai, Tamil Nadu.
No, it's Chennai itself, Lokesh. Hi, guys.
Okay, Chennai. So first of all, very congratulations to Dr. Srivathy Narayan for getting engaged to Dr. Nitin. He's also from Orenburg, and they're soon going to marry as soon as I land in India. So वो लोग रुके रहे क्योंकि मैं इंडिया में नहीं था और उनको शादी करनी थी, बट वो जस्ट मेरे लिए रुके रहे. तो जैसे ही मैं पहुंच जाऊंगा वो अपनी शादी कर लेंगे. That's why you waited, right? You both?
Exactly. I'm waiting for Lokesh.
Exactly. So this podcast is all about talking to Dr. Srivathy Narayan about a very important exam called PLAB, also FMG, because she has also cleared FMG and she's already a practicing doctor in India. She has practiced in AIG hospital, right?
Yeah, I did for AIG Hospital 1.5 years. Then I'm doing now in Continental. I'm in a leave. Now I'm in UK actually currently.
So she did. So where did you do your internship?
2021 to 2020. 2022 to 2023 in Osmania General Hospital, Hyderabad. I did.
How much did you score in your FMG? Could you please tell our viewers?
It was 207 out of 300.
207. Scoring 200 plus is not a big deal for Dr. Srivathy Narayan. She keeps doing it. She keeps doing it usually now and then.
Orenburg people score like 220, 230 above. Like I see the results every year and I be like juniors are doing very well. They have
every
good
year.
sources. We didn't have much sources actually. Dean was supportive. Everyone were supportive actually. The whole therapy department was supportive for me.
So which year did you get your admission to Orenburg? How did you get to know about Orenburg? And when did you decide to plan for MBBS Russia abroad? How was the कब पता चला कि MBBS abroad जैसा there's something exists? And then why did you choose Orenburg?
Oh, that is like so much of questions. Actually, it is very simple. I didn't get a seat in India. So my parents said like, why can't you go there? And I'm from like middle class, literal middle class. I'm middle class itself. I just hope I don't be middle class in the future. But yeah, it was my parents' effort. They suggested me like, why can't you go here? And why Russia specifically? Because my principal, she passed away. She's late Margaret David Raj. She's South Zone CBSE. I'm a CBSE student. CBSE South Zone head of biology, and doctor people who want to study doctors, they always be like bio. So she suggested me like go to Russia because compared to all other countries back in my times, Russia, Philippines, and China were more famous. She said Russia because they practice, very old kind of medicine. There's something which she said me, we have a degree called MS, Master of Surgery. Its actual was like MCH, Master Chirurgia, which means chirurgy. Chirurgy means surgery in Russian. So she said me like they are the people who are like practicing medicines in so many years, and that was true. That's the reason why I chose Russia. And Orenburg, to be very particular, is like budget issues, bro. Back in my time, I'm the second batch in Orenburg. It was like the affordable for me compared to other universities. That's the reason. I was the second most batch in Orenburg.
There was no batch graduated?
Yes, no batch graduated.
Because today only I was doing live, so students said me that Ural State Medical City, वहाँ से कोई बैच ग्रेजुएट नहीं है, नहीं जाना चाहिए, you should not go. Then I told them that you have to give a university at least 6 years so that the batch graduates from there, right?
I'll just leave this answer to the students itself. So they will be building, new government universities in the districts where there are no, hospitals. They'll try to build some, universities along with hospital, medical college and hospital. And they will be brand new. There should be someone like first batch, right? and that first batch will be like literal first batch. We can't put someone in fourth year directly. They have to start from first year, second year, third year.
They want someone who directly goes to sixth. हम लोग ही क्यों उसमें फंसे, हम लोग पर क्यों एक्सपेरिमेंट हो रहा है?
Oh, actually, they don't do they don't do any funny experiments. They do a serious experiment where, in the end of the experiment, if you pass your experiments like exams, you'll be a doctor, or else they'll tell you bye bye, paka paka to India. Russian universities are very strict. People don't understand that. Actually, he needn't worry because Ural State or any university in European or Asian like thing, no, they are all 150 200 years old, which means they practice medicine very 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 old times. So all he have to do is study in English, learn quickly the Russian so that he can interact with patients, and he just have to get involved in research and stuff. There are many opportunities, for researchers open, like literally open in abroad compared to India, because it took me like 1.5 years to at least do one study in India, but whereas in UK and Russia I did an audit and an observational study. It just took me 2 months here, and it just took
As
3
compared to
months in
India.
Russia. Teachers helped me.
So tell me something about PLAB. What is PLAB, and when was the first time you heard?
So I heard about PLAB in 5th year of med school or 4th year. We'll start searching about USMLE, PLAB, AMC, all those stuff. It's like that only. But when I actually became very serious about PLAB was like 2023, and then I gave my OET exam. We have to clear our language exam like OET or IELTS English exam.
How do you proceed, like for PLAB? What are the first steps? Like you cleared IELTS test after going to India, after graduating from here, after clearing your FMG?
Actually, I started working in AIG hospital. That is the time when I appeared for. I didn't write the IELTS because people said it is difficult. So I wrote the OET. OET is Occupational English Test. It is a separate English test for doctors, nurses, physician associates, and for physiotherapists. For only medical profession, this exam is. I think I wrote it in the month of 2023 February, on I think 25th February or 23rd February I wrote it. Then I got my result in March within 1 month. Then I booked a slot for my PLAB 1, because without English proof, passing English exam, we can't book for the PLAB 1. So I booked for PLAB 1, and during that time, there was more demand for this PLAB slots, and I have to wait 9 months to get my slot. Like I booked my PLAB 1 slot in the month of April, but I got the slot for the next year February. So I continued my working until my exam.
2024 Feb it is.
Yes, 2024 February 15th was my exam. 25th February 2023 I wrote OET. By 2023 25th March I got my OET results. By April I booked my PLAB slots.
In Feb, after 9 months, you got your PLAB one slot. This exam is conducted online, or how? Please tell me everything about PLAB, like the step, how the exam is conducted, in what format, how many questions.
See, PLAB has 2 parts, 1 and 2. First part is like MCQ session. It is pen on paper, and it can be done either from UK or from overseas, out of UK. I obviously chose the Indian center and Chennai center, and I was lucky enough to get a slot that time, and it consists of 180 questions in 180 minutes. It is pen on paper examination. PLAB and General Medical Council of UK, British Council will be conducting the exam. The location and everything will be of the exam, everything will be sent only 1 week before the exam. They don't want to reveal the location before, and it is just an MCQ. After clearing the PLAB 1, again we'll get the slots for PLAB 2. It will be opening on one day. We have to book for it. PLAB 2 exam is like more like our Stansia. You guys do, right? In Russia, we do stansia, right? Each stations we go and we talk with patients, or we talk with mannequins or Simmons, and we try to diagnose them, treat them. It is same like that, and the exam will be like for 3 hours, approximately 3 hours. This as well, and I have to go inside each rooms, which consist of each patients. I have to counsel them, diagnose them, and treat them. I'll be having different stations, checking different knowledges of mine, and it is like a circuit exam. I can send you a link. You can just pin it. At this time, people can just click the link and see how the exam actually looks. It is like a circuit. We'll be in a circuit. Bell rings. Read the question, go inside, talk with the patient, come back. But inside the room, not only the acting patient but also the examiner will be present. So they will see you, how you enter, how you talk, how you diagnose everything, and they'll mark you immediately. And for PLAB 1, I forgot to say this, the pass marks depends on that particular exam, like what is based on percentile. Usually the pass marks will be like somewhere from 110 to 120. I got 146 in my
So
PLAB
there's
1.
not a
In
fixed
PLAB
passing
2, on the
percentile.
other
It's
hand,
according to the percentile. There's no like 180 में से इतना लाओ तो तुम पास हो, ऐसा
नहीं
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 है.
ऐसा नहीं है. PLAB 1 and PLAB 2, it depends on that day how you and your colleagues perform, how you are better from them or they are better from you. It is always like that. Next thing, PLAB 2 was like, on my day, it should be my pass mark was like, firstly, each stations you'll be marked, right? Each station, they'll be marking you for 12 marks. And the stations, like the 12 marks will be divided for 3 sessions. One is like IPS, interpersonal skills. Another one is for history taking, how well you take the history. And third one will be like how you diagnose and treat them for the management. So these 3 sessions, you'll be given 4 marks. And each stations you have to pass, and overall you have to get the dedicated score to pass that day's exam. It is all, nobody can predict anything. The pass mark can be like 91, 97, 100, or whatever it is. And the number of stations required to pass can be 9 stations, 10 stations, or 11 stations based on your day. It is based on our day's performance. That's it.
Okay, so one student of Far Eastern Federal gave me a question. Her name is Bhargavi. So I told her that today I'll be, interviewing her. So she told me the first question is it okay to do FMG and intern in India and then go to UK, or to do OET or IELTS during MBBS in Russia and then give PLAB 1 through UK FPO?
See, it all depends on her. If she really wants to come back to India and she is a NEET qualified person, she has to definitely do the Indian and then go for the Russian thing. If she doesn't want to, settle in India, then she can go through the Russia to UK route itself. Because why I say use, there is a catch for student who misunderstand this point, in that rules of studying MBBS abroad. NMC has one set of rules, right? In that they have clearly mentioned, if we do our UG and PG from those 5 developed countries, UK, Australia, Canada, New Zealand, and what is that, USA, these 5 countries, you have to do your UG and PG from the same country, then you will be exempted from the FMGE. If you do your UG from any other countries apart from this 5 countries and go for a PG to the same any of these 5 countries, definitely you have to come back to India and sit for FMGE. No matter you become a consultant or your whatever it is, they don't accept it directly. They don't give you direct registration.
Everyone must at least get themselves registered in India, and then they can go for this route.
Yes.
Ask about CV building. How did she do it? What is CV building?
That is very interesting question. Today only I planned that we will start a group so that we all can build our CV We will take up some teaching sessions, audit, how to prepare audit and all those things. We will do some formal teaching sessions. uh, I'll just give you the link of that group. You can just share with her or whoever is there. They can definitely join that. We are planning to do it like monthly, 2 times, mostly Sunday, and we will pick up a standard timing in Russia so that all parts, all students can join. And this is the initiative. Today only we were planning for it.
But what is this CV building?
CV building, actually, it is nothing but if you want to work in any country. See, I don't know. I have been in Russia, I've been in UK, and I have been in India, and I have visited couple of other countries like Dubai and Malaysia as well. Okay, so as far as when I met, like how they hire for a job is not only with your marks, not only from which university you study. They see like how experienced you are, how involved you are during your experience. That involvement you'll be showing by doing few things in your CV, like attending conferences, doing a case presentation in a conference, or conducting some teaching sessions for your juniors, conducting some teaching sessions for nurses, conducting some teaching sessions for medical students. It can be formal and informal teachings, or doing some research work, getting yourself your name in publications, all those things. This is like it keeps going on and showing your talents like leadership, taking some responsibilities during your work, during your med school. Like for example, being the group leader while being in Russia is a leadership quality. I was a class group leader, and I was trying to coordinate and pass information between the teacher and students. I used to do these works, that works they can tell. It is something good. They just didn't study, like a horse just following the same path. No, they were wide open, involve themselves in multiple things. That is all is important. That is all they need. They need someone who is, thirsty to learn things. Literally, they need people who are very enthusiastic and very talkative and very good with the patient, how they approach them.
How to get more CPD scores?
Everything is same only. It all depends like see maybe I think it might be boring for other viewers, but this girl, she knows many things. Actually, she is far more ahead of
She's
leaving
full
India, I
into
think.
plab.
To get CPD points, she can attend into PLAB. Maybe she should rethink it because now UK is in crisis. By the time she graduate, maybe it might be not a good option. But
She's in
whatever
final year right
she's
now.
asking is very good for her CV actually. I got it. She have to attend national conferences, international summits that will give her some CPD points. She can participate in some workshops like suturing workshops, intubation workshops, many things. University will keep conducting one thing or the other. She should just attend it. Next, what else she can do? She can do in clinical audit. She can do quality improvement projects, and she can also try to do some case presentation in some big conferences. All same things. You better ask her to contact me personally. I'll
Okay,
tell
can do
her
it.
like what she can do.
Did you do audit?
Yeah, I completed one in AIG and one in now UK as well.
What is audit? How did you do that in AIG? What kind of audit did you do?
See, I'll tell you in it was supposed to be a clinical audit, but I think in India we don't have one particular guideline to follow. We follow either American or we follow either NHS based on each hospitals. Okay, so basically audit or a quality improvement project is nothing but you're just going to you know select a topic where you think, select an area where you think there is something lagging or something to check. Like for example, I'll tell this with an example. You are just in an hospital, you're just doing an audit on how many people are actually washing their hands or sanitizing their hands before and after visiting a patient. Okay, actual criteria is before going to a patient, after coming from a patient, you have to sanitize or wash your hands. So audit is nothing but you can just sit one day in a ward and see like how many doctors or how many nurses or how many patient attenders washed their hands and didn't wash. If they it says 100% everybody should follow it, but are they following 100% or not? If they didn't follow it, you'll just try to make them do some implementations, like give them some classes, lectures, and try to give them knowledge about the hand wash, and then you will re-audit it. And if you bring in an improvement, it completes the cycle of audit. Usually audit has 2 cycles. Yes guys, we have came to the end. I think thank you Lokesh so much for having me for this. Sorry I delayed a lot. I was really caught up with some work, but finally today we made it. I'm happy about it. And moreover, whichever pathway they just want to take, it is their wish, obviously. Discuss with your family, see your financial status, or else do whatever you're comfortable, because me or Lokesh or no one can suggest you guys anything. It is your life, live it your way. And any doubts, anything, it was a very small session, so I couldn't cover most of the questions or most of the thing. But definitely if they have any doubts, contact Lokesh, contact me. We will be happy to help you guys.
Dr. Srimati's Instagram handle is mentioned in the description. Also, her YouTube channel link is mentioned in the description. You guys can go and contact her, and anyone if you want to talk about PLAB or any kind of doubts, you can feel free to text her. Right?
Yeah, thank you so much, Lokesh.
Okay, ma'am.
Take care.
Thank you. Bye.